So I want to ask, and I'll try to see, I'll have to block the lights for a minute, but how many of you work in kind of the day-to-day operations of farming? Either from, from a supervisor or non-supervisor standpoint. Okay, that's great. Are any of you in a safety role? You sit on a safety committee, you also oversee safety? Okay, quite a few folks, great. Good. What about owners? And I realize you might have your hand up for multiple.
Yeah, I've seen one gentleman here in the back with his hand just constantly
straight up. Okay, good. And that means also human resources, personnel, hiring. Okay, great. And then there's probably a piece on marketing. And then what about like particular interests from an environmental standpoint? Okay. Yay! Okay, thank you all for being here. This is great. So maybe we go to the next slide, Liz. So Liz and I represent kind of a newer alliance in Oregon called the Total Worker Health Alliance. And the three key organizations involved in this agreement are Oregon OSHA, which we do not work for, but we did bring some Oregon OSHA documents, and we work very closely with Oregon OSHA. I'll introduce myself and my part and who I work for, and Liz will do the same. So first, Liz and I are safety and health professionals. We've both worked in the field for 30 or more years, doing traditional industrial hygiene and safety, and more recently what we're calling kind of total worker health. I'm Dee Dee Montgomery, and I work at the institute with a really long name, and I apologize for it, the Oregon Institute of Occupational Health Sciences. And we are based at OHSU here in Portland. We also have a kind of a center of excellence called the Oregon Healthy Workforce Center. And that is one of 6 centers in the United States funded to do research and outreach on this topic of total worker health, which, don't worry, we'll get to more talk about what that is. And so where I work, I lead up education and outreach, and I support really the translation of the research we do, everything from the basic science level through working with workforce partners kind of in what I might call the real world or in organizations.
Thank you. And I'm Liz Hill. I'm the Total Worker Health Advisor for SAIF, which for those of you who are unfamiliar with, we are the state work comp insurance company here in Oregon. And one of the things that I get to do, which is really fun, is I help advise and guide our strategy around total worker health for our policyholders and also for external stakeholders. So if you are a SAIF policyholder, and this is our connection and why we formed an alliance, we think that total worker health is really the way the safety and health profession is going for the future, and we'll talk about why that is. SAIF does total worker health within its organization for its employees, and also it is one of our prime consulting strategies with our policyholders. So if you are a SAIF policyholder, you have resources beyond this course, and you can reach out to your consultant, and they can help you kind of move along the path if this is something that you get interested in. If you're not sure how to do that, pick up one of my cards, and I can help connect you with that. One of the other great things I get to do is work with the Oregon Center of Excellence and the other centers of excellence around the nation, and really help take that research that they're doing in this topic and help them frame how it can work in real life.
Yeah, and we're both very active in our own kind of professional associations, the American Society of Safety Professionals and the American Industrial Hygiene Association. And what we are doing a lot of right now is teaching kind of a 2 to 3 hour class that we call our Total Worker Health 101. So just keep that in mind. That's really where we're working with folks who are really trying to do the next steps. So we're just introducing you to that today, and can do all kinds of follow-up as you're interested with future email or phone calls or whatever. So let's move on. So I think what Liz said is super important, and what we recognize is, especially for those of us that kind of wear that safety and health traditional hat, is total worker health is the future of occupational safety and health. And it's really recognizing that, safety is fundamental. We know that when people get hurt or get sick because of what's happened on the work or on the job, that not just affects them and their families and potentially their future, but it does affect your organization, right? It costs money. It can absolutely affect culture and how other people feel. And it absolutely affects the bottom line and the bottom dollar, because you're going to have to find someone else to do that job. You might have to go through retraining. You might have to find, in some cases, it's harder to get workers to do certain jobs. So there's all kinds of reasons to why retention of employees, not just because we believe it's the right thing to do, but it is definitely shows up in the bottom, kind of in the dollars we spend. And so what we're really realizing in the year 2020 is that there are so many things that affect safety that we've not really thought about or dealt with from the safety perspective. So everything from my mental health, my maybe what's happening with my families, how well supported I feel for what I'm doing on my job, how my supervisor's treating me, how other employees are treating me, how much sleep I get, how well I eat, am I hydrated? All these things now we're realizing, they all really come together into how I perform on the job and how long I'm going to stay on that job, and maybe how long I'm able to stay on that job because I'm either in pain or not in pain, or I've developed a health condition or whatever it might be. So when we talk about total worker health, you can really see we are really ultimately talking about keeping workers safe. We're not changing our tune on that. The foundation is safety. But we are really looking at the policies and procedures and practices that we can do internally to, in fact, kind of really create a higher level of worker well-being. And it's hard to do that. We absolutely recognize a lot of what we're talking about is difficult. Certain economies make it feel sometimes impossible, but we do know that the leading organizations that find a way to do that are going to continue and are continuing to be those that people want to work at and that can sustain their workforce.
And I think one of the things I really like to talk about is that we're not, like Dee Dee said, we're not changing the fact that we still need to keep people safe at work. We're expanding our view of what that means and what hazards we look at and which hazards we really want to control. So what we know, and Dee Dee sort of alluded to this, is that probably stress is the number one thing that affects our workforce in America. And just if I can get people to just think about stress as a hazard and where people are experiencing stress and how in the workplace we might help mediate that for them, then that's the one thing that I think people can take away. Like stress, fatigue, those are things in the traditional safety world we never thought we'd be talking about, but we absolutely are starting to see how strong those connections are to how people perform and their safety and health in the workplace. So,
and so as we talk about this, and I'm not going to go over each of these bullet points, and I apologize if they don't show up as well as we thought they might, but work really influences our health and our well-being. And you can look at many examples here. We just use the example of the provision of having health care, right? And I think there's some exciting things happening in your industry about looking at ways where there can be better support for people on health care services. Then there's been some interesting things going on over the years with Quality, I know, on that provision for vineyard workers. But all of these factors that are kind of that we're showing here impact how that job affects me. Depending on the kind of work I do, I may or may not have a greater risk of getting hurt or creating an exposure, an illness related to my job. My wage and location, if I'm a lower wage, I may find that I'm working multiple jobs in order to pay what I need to pay, and that puts me at additional risk because maybe my commuting is further or more, or at awkward times at the night, I'm not sleeping, I don't have time with my family to rebuild my own social my social well-being. And so these are all things that do impact work, impact well-being. And that's what we're very aware of in the whole conversation on total worker health. And what I really want to point out right here, because it can feel very overwhelming if you look at all the things that come into play, is what organizations, the successful ones who are addressing this are saying, yeah, we can't do everything right now, but what should we prioritize? What are the little pieces we are doing that we can augment? Or what are the other things that we could try and, just slowly move the needle? And there's so many different ways we can do that. In different industries, it's different. So we always say total worker health is there's not one recipe, but we're trying to do the same thing.
Right. And I think we're building more and more understanding of what some best practices are and how we can start taking a look at the whole worker or a holistic view of the people that are working for us and what can we do to support their well-being in the workplace. And that includes what can we do that's going to influence what they do at home as well as what we control as employers.
So one of the things we were asked to talk about safety, kind of as well as total worker health, which as we've both, I think, shared, safety is foundational. We're not saying you do wellness and you don't do anything else. That's really why total worker health as a term is different than traditional wellness. We are really safety as foundation, but by doing it well and looking at the bigger picture, we can do it better. But we went to our kind of friends at Oregon OSHA and said, well, do tell us the top, we're going to look at the top 5. Actually, we're going to look at very quickly, what are the top 10 things that Oregon OSHA cites most frequently within your industry? And we do not have time to go into each of them a lot, but I think some of you will recognize this. And if you sit on your safety committee or have things to do within safety in your organization, I know you'll recognize some of this. So we're going to go through these.
And one of the things that I want to emphasize is that we're going to talk about the compliance piece of safety here, but really try to make those connections between compliance with what the rules are and how that affects the well-being of the people that are working in your workplaces. So we know that if you're not protecting your employees from safety and health hazards and exposures in the workplace, that is not supportive of well-being, because being exposed to those can cause stress. They can definitely, cause harm. There's other things that go along with that, at feeling the experience of work. And how that relates to our well-being as well. So with that, the number 5 top cited OSHA compliance issue in Oregon, and I will say this is probably quite similar for our friends that are here from Washington as well, is electrical.
Right, and so if we were in a smaller group, we'd say, wave your hand if you know this, right? I mean, sometimes we kind of make fun of electrical. It's like in the sense that, yeah, we know we shouldn't be using extension cords in this capacity or under carpets, or don't block the electrical panel. But the reality is this causes a lot of fires. It causes a lot of damage when done incorrectly. There are reasons for those rules, and it has caused, personal loss. There have been people that have died because of this. And so I think electrical is absolutely something that should be at the top of your list as you're looking at your safety kind of internally. And like we said, it's going to be pretty broad brush.
Yes.
So forklift training. And again, I'll put my 2 cents in on this. Yes, we know that can be a very dangerous operation. There have been, where I work at OHSU, we also do fatality investigations within Oregon, kind of alongside Oregon OSHA. And we know there have been a number of people that have died because of misuse, improper use, or accidents involving forklifts. To try to avoid that, there are requirements that talk about training, and that training is important. You probably know there are also rules that say if you're under 18, you shouldn't be operating forklifts. And there are lots of reasons as to why some of those rules went into a place. And so kind of like Liz said, we're not compliance junkies, but we really do believe we've had enough experience in the world of safety to get that most of these regs were based on somebody getting hurt and or predictions of that.
And I also want to mention this one in particular because you'll notice that the citation is for training, but drawing the line then from the training and making it effective and then seeing that in practice is what's really important.
Yeah, I think a really important thing, it'll come up again, go ahead and go to number 3. We'll see it on each of these, is when we talk about training, OSHA really over the last couple decades has moved to effective. It's not just signing off. It's, do people really understand what you're talking about? And we'll talk more about that with number 2. But respirators, what do you want to say about respirators, Liz?
So this is a big one, right? All we know is it's respiratory protection. So that could mean that someone got cited because they didn't have a written program or they were using the wrong respirator for the task and the hazard. We do know that our OSHA counterparts that shared this information with us said that one of the things they see most frequently in wineries is that when the folks are working with sulfur dioxide, they are using the wrong cartridge in their respirators. So sulfur dioxide is one of those things that you need an acid gas cartridge for. So that's one thing you can walk away with and go check your respirators to make sure that you have the appropriate cartridge for what you're doing. And that goes for any of the substances that you might have to wear a respirator when you're using or working around.
Yeah, we often, those of us who are industrial hygienists often like to say, it's worse to wear a wrong respirator than to wear any respirator. Did I say that right? The point being that sometimes when people wear respirators, even if it's the wrong one or the wrong cartridges, they think it's protecting them and their practices change a little bit, which they shouldn't, but that can happen. So we're certainly always concerned about that.
And again, this is another topic that you could spend a lot of time on. Okay,
we've each taught people for several days on respirator programs, so maybe you can be glad.
Sometimes it's a little difficult to pare it down. So number 2 is hazard communication. This is another one, and it's interesting to me because I have been in the field for a long time. This is an easy one to cite for OSHA compliance officers, but it's also a pretty easy one to get pretty good as an employer. So this again is another kind of a broad brush of hazard communication. So this could mean that there was no written program. It could mean that the safety data sheets were not current. It could mean that there was no training that took place. So for this one, how many of you feel like, and hopefully we can see hands, feel like you have a pretty good hazard communication program at your workplace?
And again, this is sometimes called the employee right to know law, right? It's the point that if people are working with chemicals or harmful substances on the job, they have a right, and as an employer, you have a responsibility to ensure that they understand it and are trained in a way that they can understand.
Yeah. And I'd like to say that good what I saw frequently is that people would get safety data sheets, they'd go in a book and they'd go up on a wall or on a shelf somewhere, and they know they have to have them easily accessible. It's really great to take those out once in a while and use them maybe for a short training session and kind of walk through, okay, today we're going to be using this material, here's what the safety data sheet tells us. And that's just a really easy way to refresh people. And again, there's a lot of chemicals out there that have a lot of effects that are harmful to health and can impact health in ways larger than what's going to happen for that worker just in the workplace. So really important one.
Well, and I would just say for all the problem, it feels like a lot with this one, but I would say most of us who do the kind of work Liz and I do would say this is what we sometimes think is the most important regulation that's out there, because it really puts that importance of understanding to workers who have really the right to know about it, but it can be hard to do it.
And I think that, this one goes hand in glove with the pesticide applicators rules too. Yeah. So we're not going to get into that because that's the worker protection. I was going to ask how many guessed number 1 was safety committees.
Would any of you guess that if we had asked you? Anybody? Just kind of curious? Okay. No hands, so maybe not. Again, this is one of those ones, so, the rules for safety committees, and I think OSHA's done a pretty good job. They have a pretty good little guide. We've left a few copies. Safety committees and safety meetings for agriculture employers. Again, at its kind of essence, I think this is so important because this gives that opportunity for engagement. And we're going to come back to how important engagement is in a minute when we talk about total worker health. So those companies that are really leading employers from a safety and health standpoint, I can guarantee you they have active, engaged, respected safety kind of either safety committees or safety meetings, that they have a comfort level among their folks, that they can talk, that they will feel trusted, and they will feel listened to. And the more we learn about this idea of total worker health, we learn how much culture weighs into all of this. And that feeling that I feel, I feel safe to talk. I feel, and yes, we're going to talk hopefully in a civil way, and we'll learn how to be respectful, but the point that I can feel comfortable doing that, and that's really important, I think, to all humans. And we learn that in the power of culture. So that's 1 through 5, and Liz, you want to say one thing on 6 to 10?
I do want to say one thing on 6 to 10, and we're not going to go into these each specifically. But, working for a work comp company, I get to have a little insight into what is causing injuries. And I will say this, outside of motor vehicle accidents, the most severe injuries and the most frequent injuries we see are falls, and falls off of ladders is probably the most common fall that we see. So just because it's number 10 and it feels kind of like, oh, that's no big deal, it really is. And there's been a lot of research and a lot of work done around how to use ladders safely and how to select ladders. And I encourage you, if you haven't delved into this topic, to go back to your workplace and do that.
And again, pretty good information out there on ladders. I mean, ladders have been around a long time, and people keep trying to create more useful tools because they continue to be a problem. We're going to move on now. It's kind of a quick through, at least from our minds, or for our minds. So we told you now we really wanted to kind of look at that foundation for safety, share with you what really shows up in your industry, but then really come back to talk about, so total worker health, and what we're really going to do in the few minutes we have left is define what the 5 elements are and lead you to where you could learn more about them, but leave you with a few thoughts about each of those elements and how they do impact this bigger piece of total worker health. And our next slide.
Sorry, the
that's
slide
okay.
flickered, so I thought we lost it for a second.
We don't have time to go through this document. We would tell you that we do a lot of our kind of total worker health 101 training is based on what's in here, and the 5 elements come from this document. It's readily available on the internet. If you sign up with your email in the back, we'll send you a link to it, or you can kind of search it for the fundamentals of total worker health. But we wanted to make sure and reference it because it is really, it's very helpful, especially if you come with a safety, health, or I would say kind of worker comp or HR background. I think it's particularly useful.
Yep. Okay, with that, one of the first defining element is leadership commitment. And this probably shouldn't be a surprise to anybody because we know anytime we're trying something new or want to expand our view or any of those things that take resources and time for people to kind of figure out which direction we want to go, you need leadership commitment to do that. And that can take a lot of different forms. You could have something really formal. Maybe you add stuff to your mission statement, or the leadership makes a point of talking about this new initiative or new approach that you're taking in meetings or conversations. It could be just modeling good behavior from your leaders and your informal leaders as well.
And what we know is that if we're getting one message from a workforce side and we hear other messages that are different than that from our leadership side, we all start to not trust. And that really impacts not just how safe we feel, but how we show up for work. And so I think we've all had experience with this. And we'll talk a little bit more about the role of a supervisor, which is a part of that leadership, but we're saving a specific message for that.
Yep. Okay, the second one, this is another one that we could spend hours and hours and days on, and that's designing work. And here's a couple things I want to say about this. So when we talk about designing work, what we mean is that if we're going to take this approach and we're going to start taking a well-being look at how we do what we do, it's really important to focus on organizational structural things that we can do to change how we're doing things versus focusing in on the individual. And I think the next slide, those of you that have been around and done safety for a while are familiar with the traditional hierarchy of controls. This is the way we look at once we've identified there's hazards and exposures in the workplace, this is how we're going to control them. The top ones are the most effective way to control, and then the lower ones are least effective. And so what we did was we took a look at that in the total worker health field, and this is what on your right, is the total worker health hierarchy of controls. And you can see they're very similar. And again, it's the most effective at the top. So eliminate, substitute, and redesign are really we're talking about. Those are the organizational things we can do. And then when we educate and encourage, those are more individual level things. So a good example of this might be if you have identified sleep as an issue or fatigue as an issue in your workplace, and you do a few sleep hygiene classes, but you're not taking a look at what's our workload, what's our scheduling like, do we have shift work, is there a way we can think about how we change those things, then you're going to have very limited effectiveness. Now, I'm not saying don't do sleep hygiene classes, those are also an important element, but really focusing your attention up on those top three approaches.
And for many of us, this kind of, if you think of ergonomics or kind of design of work, we've learned this, right? If we continue to do the same job using our bodies versus potential tools that might be out there, we're going to wear out joints in a manner that is going to produce pain, which might make me not able to do that job any longer, versus something higher up that is actually going to eliminate or substitute or change up that. So what we're really doing with the ones on the right, as Liz said, is really expanding it to things we might not have thought about traditionally with safety, but that are impacting the amount of stress. Why is there so much stress on our folks at work? Is it because they could use maybe some financial planning support, Oregon saves? Is it because they're being bullied on the job? And there's a whole piece of that is a different way of thinking, but the bottom line is it all impacts my safety on the job, and we know that. There's pretty good data showing that. So engagement, we've already alluded to this a little bit with the power of what a safety committee can do. But what we know is the more engaged our workforce is in everything around work and the opportunities for them to be engaged. What we know in the safety field and what we've said for decades and decades is the person that does the job knows how to do that job the best. And if we don't allow an engagement to bring those ideas in, then we're not only missing the boat maybe on a way to do that work better, but we're also missing the boat on engaging that person to feel that they're part of the organization itself. And again, in the bigger picture of total worker health, that can make a huge impact on how someone feels about working and how long they might plan to be with your group versus looking for someone else or looking for somewhere else. Great. And I know we're kind of running out of time already.
Okay, confidentiality and worker privacy. This one I'm not going to spend a lot of time on, but as you can see, as we expand our view, we're going to be looking at things like maybe health data, or we're going to do surveys where we ask people questions about how they feel about work, or there might be other information that we're going to look at that we really want to make sure that we protect. And this is where if you have separate HR, it's really important to engage with those folks and let them know what you're doing, and they can certainly help you with this. But and I think this one is particularly important. We're having a lot of conversation in a lot of industries about mental well-being, suicide prevention, and that is where, it's very sensitive for a lot of people, and if we can't keep the efforts that we're doing and the information we're gathering around those topics, confidential and private, then we're going to lose people, and we're going to lose that engagement, and we'll lose trust as well.
But we need to know how to offer support and services. So there's really a lot there. And if you're interested in that topic, look at what the construction industry is doing right now. It's pretty profound, and it's really pretty telling and very positive. Our final Fifth one is integration. So this is that piece where, what makes it not traditional safety is this idea that we're trading notes with all, we might be a small organization, so we're already doing this, but if we're a larger organization, the folks that are trying to look at maybe environmental sustainability and wellness, and the people that are designing operations and shift work, or the length of shifts and the safety piece, we've got to be able to trade notes and look at how we can come on initiatives, bring things together so they're really more inclusive of really this moving ahead and looking at the whole worker, the whole person.
And I think an important piece of that is the compensation and benefits piece that traditionally in safety and health we haven't been that involved in, but it really does impact people's well-being and safety and health to know that they are supported in terms of maybe health care or behavioral health treatment or even financial counseling, things like that, the things that are worrying them and keeping their mind somewhere else than the job. We can certainly make ties to safety and health there as well.
Yeah. In the last couple of minutes, we just want to mention two things. So we've talked about stress, and I know this is a little hard to read this slide, but these are things that while they might feel unattainable, research has really showed that stress at work can be lowered when there's a few things that we try to impart into a job. And one is some level of control over life or our schedule. Now that doesn't mean I get to choose everything about my day, but every job that we do, there can be a little more control built into even things that may seem very small can make a difference. And I think the rest of these things, I think the last one I would show is the power of social support. If we've ever had the opportunity to work for an organization where we really love to go to work, a good part of that is we have this strong sense of social support. And that we can build that, and that really feeds so much back into everything we're talking about. So I would kind of leave you with that thought, and then one more slide, which is, where I work, there's a lot of research showing the power of supervisor training and support. And so many supervisors are not actually trained how to supervise people very well and how to support them in their lives outside of work. So Liz might want to add something to this, but I would just, if you want to know anything more on this, we will add some links to some work on this if you sign up for the email, for sure, or talk to us.
Yeah, thank you very much. And I think that we are wrapping it up so we can get the next session started. But I want to thank you all for being here. It's great. Dee Dee and I love coming out and talking to different groups. And again, our cards are on the back table, and you can certainly sign up for our follow-up email where we can share a lot more information with you.
So thank you all.